The summer months are quickly approaching, and with that comes more sunshine, which means it's a good time to talk about protecting your skin, especially today, right? And whether you're out in the sun a lot or not, it is vital to wear sunscreen. So here to talk all about it, family medicine provider at Kaiser Permanente Capitol Hill Medical Center, Patricia Egwuatu. Welcome.
Thank you for having me.
Always love having you. Okay, so first of all, I'm sure all sunscreens are not created equally. So what should we be looking for in a sunscreen, and how often should we be applying?
That's a great question. So sunscreens, broad spectrum sunscreens, are created to help protect us against the UV rays of sun. And so you want to look at a sun protection factor of greater than 30. So SPF greater than 30, and you want to be able to reapply it every 2 to 3 hours on all exposed skin, and that includes your lips and your ears, but also keeping it in a cool, dried place, and also thinking about the expiration date. We always usually pull it out like when it gets more sunnier, so you want to make sure that's not expiring. And also thinking about for patients, like people of color, is that most often people are not thinking that sunscreen is for them, but actually the sun affects all individuals of all skin types, so you want to layer on that sunscreen.
Okay, no matter who you are, wear the sunscreen. And I know there's chemical sunscreens and then mineral sunscreens. What is the difference here?
That is very true. So chemical sunscreens are actually absorbed into our skin. They bounce off those rays by the absorption of the sun, but then the minerals actually create a barrier, and they have different minerals like zinc oxide, and so those are the difference. Also the consistency of like the thickness. Chemicals are usually lighter and minerals are more thicker, but they can actually be more beneficial for like minerals for people with sensitive skin.
Okay. I know a lot of skincare products say that they have SPF in them, even like a powder that you wear or like a primer that I recently bought has that. Do these products really protect your skin enough?
They do. They work. Yes. Yeah. So it's good. So if you can get
I was hoping for that answer.
So if you can get SPF in like honestly any forms, even in a tinted foundation, a moisturizer, they're great. But the difference is that we're probably not applying it all evenly like a sunscreen. And the other thing is that also like with foundation or moisturizer, we're not reapplying it like maybe multiple times during the day. So that's a difference. So it's great to use a sunscreen, but if we can get it in a moisturizer, a tinted moisturizer, foundation, I'm all for it.
Okay, sounds good. And you know, here in Seattle, we don't always get as much sun year-round as other places in the country. How worried should we be about skin cancer here in Seattle?
We should actually be really worried. Like skin cancer in the Seattle area is actually in the top 10, and that's the reason being is that we actually are not using it enough. It's usually cloudy, dark, gray, and overcast. So oftentimes people are like, hey, I don't need that sunscreen, but in fact, you really do. Those UV rays are still penetrating through.
Oh my gosh, that's really good to know. One of my friends who has experienced this, she always looks at the UV index on her weather app. And that's something I started doing too, because it was like, it doesn't always feel like the sun is shining hard on you. But like you said, it is. If someone does have a concern with their skin, at what point do you need to talk to a doctor about that?
At any time. I get patients of all types just coming in like, hey, I have a skin lesion of concern, and that's where we can look at it. We can tell them about the risk factors, talk to them about the risk factors. And I talk to them about the ABCDE, which is the acronym that we use for skin lesions. So looking at the asymmetry of the skin lesion, looking at the border, you want to look at the color and make sure that's like dimensional, and then also looking at the diameter, making sure that's small enough, and then how it's evolving over time. Those are some tips I talk to patients about.
ABCDE, that makes it so easy to remember. Okay, so outside of wearing sunscreen, what other precautions should we be taking?
You know, reapplying every couple of hours if using the sunscreen, but then also like just clothing that is light, kind of breathable. You can wear a hat, not being in the sun like when those UV rays are like high, so between 10 and 2 usually are some precautions I recommend.
Okay, and then what about spray versus cream sunscreen? So I'm not gonna lie, when it comes to the body, I don't always want to do the cream, I do the spray, but is one more effective than the other?
It's totally fine. A spray is great.
Okay.
Yeah, because I mean the spray is like quick and easy, and it can get more of a body surface area, especially for like kids. Like it takes forever to put the lotion on, as you're mentioning. So if you get a spray or a cream, it's totally fine just putting on that sunscreen.
I like it. And sometimes you're by yourself and you don't want to like ask a stranger to get your back or shoulder in area you can't reach. So okay, we are pro spray around here. Thank you so much, Patricia. Such important information.
Thank you for having me.
Yes, and we've got more info on Kaiser Permanente. You can find that on our website.